In the previous tips to lasting weight loss, we discussed how important the thyroid is in being able to burn fat and lose weight, and how there are 6 basic mechanisms or patterns of thyroid dysfunction that can contribute to your inability to lose weight and keep it off. We also learned that the basic testing that most physicians run, just TSH and total T4, are only able to identify one of those patterns. So when I consider that a person might be suffering from a less than optimal thyroid system, I often recommend the following tests. Number 1, I do recommend TSH. It's a very important test. But you need to recognize that it's not the only important one. Number 2, we'll also recommend the total T4. Again, this is a very important test in telling us how much T4 your thyroid is able to produce. But again, you need to realize that it's not the only test. Number 3, we'll order a free thyroxine index. This test gives us an idea of the activity of the free T4 in your body, and also can give us some hints as to whether medications are affecting your thyroid binding ability. 4th test we may recommend is a free T4. See, total T4 measures bound and free, but free T4 measures the amount of T4 that is active, that can begin to affect your body. Bound T4 cannot be converted to T3, so we need to know how much free T4 you have. 5th test we might recommend is a T3 uptake. This measures the amount of T3 binding sites, sites in your cells, sites in your body that can actually absorb the T3. Number 6, we want to order a free T3. This tells us how much active T3 is available. Again, bound doesn't help us if it can't eventually be released for the cells to use. So free T3 tells us how much T3 is actually available for our cells to use. And number 7, I almost always want to order thyroid antibodies. The reason for this is it gives us an indication as to whether your thyroid problem is a simple thyroid problem or an autoimmune condition. In an autoimmune thyroid problem, your immune system is attacking your thyroid, and we usually handle that in a different manner than if your immune system is fine, but it's your thyroid problem that's malfunctioning. See, identifying the cause of something is the key to helping handle it. So we need to know if those antibodies are positive to give us an idea if you have a autoimmune thyroid condition. Now, those are what I consider basic tests, much more than the TSH and T4. However, in more complicated cases, we also may measure what we call a reverse T3. See, when your body converts T4 into T3, some of that T3 is what we call reverse T3. Reverse T3 is useless for your cells. They can't use it to control your metabolism and produce energy. So, if you're producing too much reverse T3, that's a problem that needs to be addressed, and we need to know if that's happening. Sometimes we also measure the amount of thyroid binding globulin in the body. Because again, if there's too much thyroid binding globulin, not enough T4 T3 is going to be released as free T4 and free T3. If it's not free, if it's not active, your body can't use it, no matter how much is still bound to the thyroid binding globulin. So you can see that there's a lot more to the thyroid than measuring your TSH and total T4. They don't help identify a lot of the patterns that are very common when someone has a problem losing weight due to thyroid problems. So if you do the right things, if you eat right and exercise, but you're still having a problem losing or maintaining weight, you really need to look into your thyroid to see if that's the factor behind your problems with your weight. This is Dr. Smith giving you the keys to healthy, lasting weight loss.